Now we'll see what are the main differences between the male and female pelvis. See here, if you take male pelvis, it is heavier and muscular markings which are present over these bones are very prominent. But in case of females, it is lighter and muscular markings are less prominent. Then iliac fossa is more concave in case of males. Actually, this is iliac fossa. This iliac fossa is more concave in case of males than the females. So, in case of females, this fossa is very shallow. Then, anterior superior iliac spine, inverted in case of males. But in case of females, it may be everted or projecting anteriorly. Then, ischiopubic rami is thicker. Here, this is ischiopubic ramus. In case of males, it is very thicker and the inferior margin is everted. See here, this inferior margin is everted. So, this pelvis belongs to male. But in case of females, this ischiopubic ramus is very thin. The lower border is not everted due to weak attachment of crus clitoris. Actually, in case of males, very strong attachment of crura of the penis. That's what it is everted. But in case of females, this will give attachment to the crus clitoris. Then, here we will take transverse diameter of two margins of acetabulum like this. Then, the same diameter, if we take the anterior margin of acetabular margin to the symphysis pubis. This is almost similar. But in case of females, what will happen? This diameter is more than the acetabular diameter. That means this acetabular diameter is less than the diameter which is extending from the anterior margin of acetabulum to the symphysis. That means what is happening here? After attaining the puberty, this pubic bone will be growing more. That's what this anterior part becomes enlarged. And at the same time, if you observe here, this is transverse diameter of body of first sacral vertebrae. And this is the ala. See, the transverse diameter of body of first sacral vertebrae is more than the length of the ala. Is it? But in case of females, this diameter and this diameter will be similar. That means what is happening here? After puberty, pubis is growing so that anteriorly transverse diameter is increasing and this lateral mass or the ala is growing laterally. So that anteriorly and posteriorly the transverse diameter is increasing. That's what in case of females it becomes almost oval shaped pelvic cavity. Then obturator foramen. This is obturator foramen. In case of females, this obturator foramen is smaller and triangular. This obturator foramen is smaller and triangular. But in case of males, the obturator foramen is oval and larger. Oval and larger. So, this is male pelvis. Clear? Then, preauricular sulcus. Actually, here, this is auricular surface of the ilium. Right? In front of the auricular surface of the ilium, you can find one sulcus. That sulcus, what we are calling preauricular sulcus. This preauricular sulcus in case of male pelvis, you can see very scarcely. But in case of females, it is very prominent because ventral sacroiliac ligament will be attached and it will be stretched so that there will be formation of groove. That groove what we are calling preauricular sulcus. In case of parasomniums, that means the mother who given birth to the babies, in those individuals, that preauricular sulcus will be furthermore prominent. So, these are the general differences between the male and female pelvis. Then, pelvic inlet. Actually, all diameters, that means anterior posterior diameter, transverse diameter, oblique diameter, all diameters of female pelvis is more than the male pelvis. Then, we will see the pelvic cavity. Actually, here we have to take two cones. Here, we will take two cones. One cone is longer cone and another cone is shorter cone. Now what we have to take is short section of long cone and long section of short cone. That means if you take this part, how it will be? It will be like this, right? But here it will be like this. This is male pelvis and this is female pelvis. Male pelvis is long section of short cone. That means the shape of the male pelvis is long section of short cone. But in case of females, short section of long cone. That means if you take section like this, coronal section, and if you observe, in case of males, it will be like this. That means if you take at the level of ischium, it will be like this. It is tapered downwards. But in case of females, it is straight. It will be vertically present. So it is cylindrical, but it is conical. This is cylindrical and this is conical in shape. So in case of males, pelvic cavity is longer and more conical in shape. But in case of females, it is shorter and cylindrical. That's what female pelvis represents, the short section of long cone, and male pelvis is long section of short cone. Right? Then symphysis pubis is elongated in case of males. See here, the symphysis pubis is elongated in case of males, but in case of females, the symphysis pubis is very short. That means it will be, the symphysis pubis will be very shorter or very less length in case of females. Right? Then the vertical growth of ischium is more in case of males. That means this growth is more in case of males than the transverse growth of pubis. So in case of females, transverse growth of the pubis will be more and the vertical growth of the ischium will be less. That's what, if you take one index, ischiopubic index, the length of the pubis we have to take, this is the length of the pubis, and we have to take the length of the ischium. So we have to express length of the pubis by length of the ischium into 100. You will get some result, right? That result in case of males, it is less than 90. But in case of females, the ischiopubic index is more than 90, right? Then kilotic line. What is kilotic line or chilotic line? Anything you can write. Kilotic line or chilotic line. Spelling is CHILOTIC. Kilotic line or chilotic line. You have to extend the line from the iliopubic eminence to the anterior margin of auricular surface. See, this is auricular surface. Then it extends up to the iliac crest. Right? So this line what we are calling kilotic line. If you divide into anterior part and posterior part, the anterior segment of this line is shorter in case of males, but in case of females, the anterior segment is longer than the posterior segment. So these are the differences in the pelvic cavity between the male and females. Then pelvic outlet. See, in the pelvic outlet also, almost all diameters will be less in case of males, more in case of females. Actually 1 inch less in case of males than the females, right? And here one more thing we have to discuss here. This is pubic angle. The angle between the two conjoined ischiopubic ramus, what we are calling pubic angle. This is pubic angle, right? So this pubic angle in case of males, it is 50 to 60 degrees. But in case of females, it is around 80 to 90 degrees. It will be more. Why? Because of wider pelvis. Then, what is this notch? What is this notch here? Greater sciatic notch. This is greater sciatic notch. Right? This greater sciatic notch is narrower in case of males. It is wider in case of females. So, the angle and depth of the greater sciatic notch in case of males is narrower than the females. The angle is around 50.5 degrees in case of males. The same measurement or the same angle here, this is angle will be present now. This angle is 74.5 degrees in case of females, because sacrum and coccyx are pushed backwards, right? So that this angle will be more. Then what are the other differences? See, this is ischial spine. This is also ischial spine. These ischial spines are inturned or inverted in case of males, but in case of females, it is everted or outturned. It is projected outwards. In case of females, it is projected inwards in case of males. Then if you take the differences in the sacrum, the length is longer and narrower in case of males, but in case of females it is shorter and wider, right? Then one index we can see here, sacral index. That sacral index expressed as maximum width by maximum length into 100. You will get one result. That result is sacral index. That sacral index in case of males it is 105, but in case of females sacral index is 115. Then you will see the curvature of sacrum. Actually, curvature of sacrum in case of males it is uniformly curved. See, this is curvature of sacrum. It is uniformly curved. But in case of females it is flatter in the upper part and in the lower part it is abruptly curved. Actually, the pelvic surface bend twice in case of females, in between the second and third sacral segment and fourth and fifth sacral segments you can see abrupt bend. Then another difference is in the coccyx. What is the difference? Coccyx will be immobile in case of males, but in case of females it is more movable to facilitate the accommodation of head of the fetus. Then sacroiliac joint permits limited movements. Here, see this is sacroiliac joint. This sacroiliac joint permits very less movements in case of males, but in case of females this joint permits rotatory movements during pregnancy due to the relaxation of pelvic ligaments. So these are the different differences between the male and female pelvis. Then we will see the classification of pelvis. Actually, one classification we have already seen. This is the classification based on the shape of the pelvis. Is it? If it is heart shaped, that is android. If it is oval shaped, that is gynecoid. If it is anteroposterior diameter is increased, that is anthropoid. If it is transverse diameter is more, that is platyploid. This classification based on the shape of pelvic inlet. Then according to the measurements of pelvic inlet, we are dividing into different types. What are those? First one is dolichopelvic. In that anteroposterior diameter is more than the transverse diameter. Actually, it assumes the anthropoid shape. So what is this? Dolichopelvic. Dolichopelvic. Then another type is transverse diameter is more than the anteroposterior diameter, about 1 centimeter only. Transverse diameter is more than the anteroposterior diameter, but not much, only 1 centimeter. This type of pelvis, what we are calling mesatopelvic. Mesatopelvic, right? Then another type is transverse diameter is more than the anteroposterior diameter, but how much? 1.1 to 2.9 centimeters, right? So this type of pelvis, what we are calling brachypelvic, right? Then another one, it resembles our platyploid. Transverse diameter is too much more than the anteroposterior diameter. Okay, so how much? It is 3 centimeters or more than 3 centimeters. That type of pelvis, what we are calling platypelvic. So these are the different types of pelvis. Now we will see what are the applied aspects when difficulty of the labor will be happening. See, here one conjugate is there. What is that conjugate? This is obstacle conjugate. This obstacle conjugate, if it is less than 10 centimeters, she may be having the risk of difficulty in the labor. Then if the distance between the two ischial spine, see this is one ischial spine and this is another ischial spine. If the distance between the two ischial spine is less than 8.5 centimeters, here also there will be risk. Then when the distance between the two ischial tuberosities, see this is one ischial tuberosity and this is another ischial tuberosity. If the distance between the two ischial tuberosities is less than 8 centimeters, there will be risk. When the fetal head is present above the pelvic inlet, even after the onset of labor, there also there will be risk. Okay, so these are the different applied aspects, right? So I hope you understood. That's it for this session.